Hey guys, real quick, before we get into it, do us a favor and subscribe to our channel. That way, you don't miss out on any of the tea. Thanks. Hi.
Hey, Charles.
Welcome back into this beautiful courtyard on this lovely fall day.
Yes.
Cheers.
Cheers.
So, for the listener, we've been having some conversations of we really like this trajectory we've been going in terms of like higher ed in Louisiana.
Yes.
And there's a lot of diverse topics in terms of just the various colleges throughout the state and things that we're going through. So we have decided we're going to kind of start highlighting some of these issues.
Yeah, what's going on with higher ed in Louisiana?
We've talked about the University of Louisiana Lafayette, where Etosha attended university. And today we're going to talk about another college that has some really exciting developments going on that we felt we should highlight. And that is the creation of a medical school for Xavier University.
Yes.
So Xavier is establishing a medical school in partnership with
Ochsner,
and it'll be, I keep getting this confused, the 5th or the 6th HBCU-based medical school in the country.
Nice.
So they are currently in the development stages of bringing this online, and their home base will be Benson Tower in downtown New Orleans, which is right next to the Superdome. And this is really exciting.
Yeah, this is awesome news.
In terms of expanding healthcare and building on the healthcare industry. So I kind of want to just hear your thoughts. And Ochsner's partnering with them, and you have a history with Ochsner, and just what do you foresee this becoming in like the Southeast Louisiana region?
Yeah, I mean, I think anytime there is a growth in the space of healthcare, that's always a great thing to see. It is probably one of our most stable industries when you look at kind of what you want to build in your city. To have a strong healthcare corridor is always a great thing, right?
I like that.
We see that in Dallas, we see that in Houston. And so seeing that investment in the infrastructure around healthcare, right? So not just we have hospitals, right? But we have medical schools, we have research facilities, I think is really important. I think it goes really hand in hand with what Xavier's already well known for, which is pharmacy. They've also developed a nursing school there. So I think it really is just kind of that next step and that next layer. And then especially from a higher education standpoint here in Louisiana, it's always exciting to see that kind of growth. So I really think it is a great thing. You can look nationally and see that it really is important to increase the number of Black doctors that we have here in America. I think particularly in the specialties, right? So to have an organization like Ochsner, which is a multi-specialty health system that already has a significant presence with their medical school program in Queensland. Queensland, Australia.
Yep.
And so to really see that growth and that investment, I think is really important and really exciting to see.
Kind of following the press releases of how this is going and rolling out, Xavier has such, you're correct, like the pharmacy program. And, Xavier long touts that statistic. They send more Black students to, medical schools than any other HBCU. But now we get to keep
them here. Yeah.
And that is what is so advantageous about this.
Yeah.
And we're building a pipeline, right? And this growing healthcare industry in New Orleans, South Louisiana, and to have that name recognition of Ochsner to partner with them, right, means that we're investing in it. And I like how you put it, investing in the infrastructure, right? It's not just a name or just a building. Like there's a robust curriculum being developed strategically, I would hope, to, we have very specific problems that are more acute down here, and I foresee them really kind of integrating that into their curriculum. What do you think?
And there's a service pipeline, right?
Yep,
so
absolutely.
You can be educated here, from start to finish. You can do your undergrad here. You can go to medical school here. And then there are facilities to come and work in. There are places to train. And so it's very exciting to really see that development in place. And that it is, sort of creating this ecosystem that can really help our healthcare systems here flourish, but also keep, bright, exciting talent in Louisiana. I think also when you look at Ochsner's reach, not just in New Orleans, but across the state, and even more so across the Gulf Coast region, the opportunity to keep that kind of talent in this area, I think, is really important. And it really shows, an investment on both sides, Xavier's growth as a university and Ochsner's continued commitment to developing, again, not just in New Orleans, but across the Gulf Coast, developing quality healthcare.
The other exciting thing about this is part of a larger puzzle
Yeah.
of expanding what is called the biomedical district in New Orleans. And all that really means is cities often create these special taxing districts where a certain percentage, to like 2% of businesses within that geographic zone goes to reinvesting in that area.
Right.
And in the case of New Orleans, it's centered around Tulane Avenue, Mid-City, which has, you have Xavier University, University Medical Center, the VA, Tulane Medical, LSU Health Sciences Center. And it's all part of this growing ecosystem where things in this district, right, are creating an industry that has long been a small part of the economy, but is, I think, an increasingly stronger presence in our economy.
Absolutely.
In a city that we're constantly talking about diversifying away
what
from
other
just
things can we do other than
hospitality
hospitality and
and
tourism? Right.
So it's exciting, and you bring up a good point. Other cities have been doing this, right? Another example, I think, is Pittsburgh,
Yes.
Boston, St. Louis is another really good example. St. Louis has created this whole area centered around the kind of the healthcare industry. And it's been frustratingly slower to get off the ground here.
Yeah.
Which, we've talked about other topics in this podcast of things tend to be a little slower in New Orleans. But it's exciting to finally see this come to fruition, right? And there is an end in sight.
And I think what's important to note, right, is when you have these really strong healthcare ecosystems or healthcare corridors, some of the things that kind of anchor that are research facilities and research institutions, right? And so I think that is very important, right? You can't just say, okay, we're going to have like this corridor where there's like a VA hospital and then like a public hospital and like this is going to work, right? It is definitely that investment in the research component and the research aspect. And so I think that's why it's so important having Ochsner, which is a teaching facility and is a large research institution, partnering with Xavier in this, because again, it really is going to create, I think, a very solid anchor for our already existing biomedical community.
Do you think Ochsner was the logical choice to partner with Xavier? Or do you think there was other options in terms of, or like, could Xavier have, and I ask this from an ignorant sense, like, could Xavier have done this on their own without a partnership?
One of the
how that works.
One of the really important components of medical school, right, is that you actually have to have some place to go and do rotations, right?
True.
So, can you be a medical school that does not actually have a hospital? Absolutely. There are medical schools that exist like that. But it certainly does make it easier to facilitate training and rotations for your students when you are affiliated with or have a strong link to or are a part of an existing health system. So it does make a lot of sense. Obviously here in New Orleans and in Louisiana more broadly, there are really kind of two players in the healthcare space, and that is Ochsner as well as LCMC, right? Both do have teaching facility components to them, right? So Ochsner has their Ochsner Health system aspect, and then LCMC now has University Medical Center. So both have that infrastructure. I would say, the advantage for Xavier in partnering with Ochsner is just the size and scale and scope of Ochsner as an organization. LCMC is growing as well, but not nearly at the same pace and at the same breadth as Ochsner is from a regional perspective.
Yeah.
So when you think about being able to have your medical school tapped into Alabama, Mississippi, all across Louisiana, certain parts of Eastern Texas, Ochsner really is the partner to be looking at to do that sort of thing.
It also makes you, and now I'm thinking, you have the Charity School of Nursing at Delgado, which I think is Ochsner also, right? The new City Park campus. So we truly are creating this intertwined, in a way that, it's pretty wild to think how the healthcare industry has changed since Katrina. It was
Absolutely.
not
the landscape is completely
what
different.
It was at all. And kind of see it continuing to evolve in this duopoly, I guess, if you want to call it that way.
And I think the two things you hear the most is we don't have enough nurses and we don't have enough doctors from underserved minority backgrounds, right? And so Ochsner has definitely stepped up in kind of filling the gap on both of those fronts, developing not one but two new nursing schools, and now this partnership with Xavier. So I think it really is about sort of, for lack of a better term, putting your money where your mouth is, right?
That's a good way.
They have really invested in an infrastructure that not only supports their organization, but more broadly supports the health and wellness of our state and region.
I'm very excited about this.
I think it's super exciting.
I really am a champion of anything that just kind of adds more to the healthcare industry, because they're good jobs. They're
Absolutely.
good paying jobs. They're plentiful jobs, right? And
Yeah.
they're needed. There's always going to be a pipeline needed for all of this.
And the longevity, right? You always need doctors, you always need nurses. These are institutions that aren't gonna, disappear tomorrow. And also the ability to serve communities beyond just New Orleans, right? While there is significant need here in New Orleans as it relates to healthcare, managing chronic conditions, mental health care, all of the things. The things that we're feeling here in New Orleans, like multiply that times 10, and that's the need in our rural communities. And we know how much of our state still is rural. So when you think about cultivating that talent here in Louisiana, it just makes it a direct pipeline for saying, okay, you went to school here, you went to university here, you're familiar with our community, you're familiar with our culture. How about you go and serve in Alexandria,
Correct.
Monroe, Natchez? Like, it really does, I think, create a better infrastructure for serving southern rural communities from a healthcare standpoint.
And, also for the state at large, this is one way to mitigate brain drain.
Absolutely.
Right? Because, it's that much harder to bring them back.
Yeah.
Prior to this, if there was no medicals at Xavier, you had to go elsewhere,
Right.
unless you stayed for, LSU or something. But it was probably that much harder to bring them back. So when you're here, you become more invested in the community, and you're much more likely to probably stay and practice in the community in which you went. So I think this is a win all around.
100%. Yeah, I agree.
When they first made that announcement, I was like, yes. It also does put into perspective. It's pretty wild to say there's only like 5 or 6 HBCUs that have a medical school when you really kind of sit there and think about it. So I think it's a positive that we're tackling that issue.
How do you think this is going to more broadly impact the biomedical district, right? Because we've kind of seen some ebbs and flows since that was sort of first dreamed up and kind of come into fruition. We have seen that, Tulane has moved some components of their downtown campus elsewhere. So how do you think this might impact that?
The biodistrict is so interesting. It's a moving target. And there's definitely this sense of collaboration amongst the different universities, because they're all working towards the same goal, which is creating this industry. And I know, and I don't want to get the wording confused here, but I know there's a big end game when it comes to like UMC is creating this designation of like it's not cancer, like a research type thing that you see in other states, but we need to be accredited.
Mm-hmm.
I think it just adds that much more value when you have another university added to the element, right? So when you have Tulane and Xavier and LSU and Delgado and even, where I teach at Nunez, right? We're creating something that has really not existed before.
Yeah.
And I think there's just more strength in numbers. Why other cities have done this successfully. So we're not reinventing the wheel. We're just taking something that's done. We just haven't had the political will.
Yeah.
And we have the political will now, backed up by these universities. So I'm optimistic that this will be a very good thing in the long range. We're doing the hard work now in terms of establishing it. I don't necessarily see any negative to this. Do you?
I don't. I think it is
and there's always negative,
overwhelmingly good thing. With anything, it's not going to be perfect, right? There are going to be growing pains, and I definitely think it will be interesting to see in the long term what this does mean, both at a more local level here in our region, but also nationally with regards to how we are elevating people's perspective of healthcare education here in Louisiana and here in the Gulf Coast region. So I think overall it is a really, really good thing. I'm very excited to see, how this continues to grow and flourish and what comes of it. I think it's amazing for Xavier, right? This is a world-renowned university. I think a university that has really excelled in the sciences. And so it's very exciting to get to see it sort of like take that to the next level,
Absolutely. Next level.
This is really huge for them on a national level as well as a global level, and again, with an institution like Ochsner that has not just regional, not just national, but international reach, the kind of level that will help bring Xavier to, I think, is extremely exciting.
I agree. And just kind of to bring this to the end, there's other Xavier's on a roll right now.
Yeah.
They're building a new dorm right now. They're doing
So
a lot
much
of
construction
investment
over there.
on their main campus. And I hope at the end of the day, this creates like geographically a seamless connection between Xavier, because Xavier feels like kind of an island on the other side of the interstate. So this is an opportunity to kind of meld it in and truly make that bio district a cohesive, area in the city.
Yeah.
So yeah, I think this is exciting. I think it's important we talk a lot about problems, but I think it's important to also bring up good things, right?
Yeah.
Good things are happening.
I think especially
and to bring awareness
in the realm of higher ed, we've talked about some of our concerns around higher education, some of the struggles that higher education is seeing. So yeah, it's really exciting to have a really positive thing and an exciting new change to talk about with regards to higher ed.
Absolutely.
Well, Charles, this is a very interesting conversation.
Absolutely, and I'm digging this higher ed thing that we're getting our little groove. So thank you for participating.
Yeah, we'll continue to stay on top of it.
Absolutely.
And we will definitely be giving updates. If there are any topics that you want to hear about, definitely drop us a DM, send us an email, let us know. And as always, we are looking for that feedback. And if you would like to get these episodes early, be sure to check out our Patreon.
Yeah.
We're dropping weekly now, but if you're a Patreon subscriber, you will get the next week's episode a week early. So definitely check that out, and we look forward to seeing you guys next week.
Stay informed. Till next time.
Bye.
Bye.
Thank you for tuning in to this week's episode of Pelican Briefs.
If you haven't already, go ahead and hit that subscribe button.
If you are loving the show, you can help us keep the conversation going by supporting us on Patreon.
Your contribution on Patreon ensures we can continue producing quality content you love.
Click the link in the description to become a patron today.
Until next time, this is Pelican Briefs.